I think this is a cunning plan to have such a interesting and important topic as our last session for the day. It helps keep people connected. Talking about being connected, we will have that a QR code up there so that we can take audience questions. I will see how we're going on time and do my best to incorporate them. So with the COVID pandemic, we certainly have a lot of people who want to move on from it, and that is very understandable. We would not be meeting here if we weren't able to move on from it. But with Africa, we have seen through the pandemic that as a continent, we've been able to work together really well, and it's mobilized us on the healthcare front. Even so, we have very little capacity, homegrown capacity, in terms of vaccine making and pharma generally, even though we use a fair bit of the global vaccine demand, almost a quarter, we only produce about 1% of what we need. So looking at the future of drugs and vaccines in Africa, Lamia, I wanted to start with asking about Morocco. And out of a handful of countries on the continent, it does produce vaccines. It produces a lot more too. What do you feel has been the main drivers enabling that?
Okay, thank you. Thank you for inviting me in Bloomberg at a very interesting session. So my experience is very positive with COVID, and I can tell you about this positive experience in Morocco also. COVID was a crash test for all the countries, and we didn't see the difference, unfortunately, between West and East and the South and North countries. And Morocco has really a good experience in this COVID time. And this is due to many factors, but the main one was the involvement and the goodwill of the supreme authority, which is our king, Mohammed VI, who really handled all this matter from the beginning. So in 1 year, Morocco succeeded to have a clinical trial for a vaccine, for COVID vaccines. In 1 year, we succeed to manufacture a vaccine in Morocco. I'm very glad to be part of this experience because my company was involved in these clinical trials, in this manufacturing. So really live a very big experience. And for the first time, I think, in my life, and in my life in pharma industry, it's long now, it's the first time that I see that cooperation between public and private was very strong. And we saw how it goes very quickly when partnership is here and when we have the same goal. So this is the first, and thanks to our king. First thing, what is important to know about Morocco also, and it's due to thanks to the strategy of Morocco 50 years ago, its incentives put in for pharma industry. It is very important to say, because we will talk after about Africa, and as a company, I'm also in some African countries, and we see the Moroccan model, and we see that if it could be the same in other countries, I think Africa will have another image in terms of health and in terms of medication. So in Morocco, thanks to all these incentives and some laws to protect, we are producing more than 70% of our demand. That means that during COVID time, the agility of the companies, and here we are talking about national companies and also big pharma who are implementing in Morocco, and the agility they work with, the efficiency, we didn't have any shortage comparing to other countries, and probably nearhood countries would have many shortage, and we were able also to give to our neighbor African countries some medication that they don't have, because you know that during this COVID time all the frontier was closed, and yes, so it was very difficult to have medication. So in general it was a very positive experience, and what is more positive is that health now is in this stage. So, so we know now that health is very important, and the autonomy and the sovereignty of a country in terms of medication and in terms of health is very important also. So I hope that it will be a warning for all the countries that they have to start to thinking more about this.
Viraj, I mean, health is important, but it's also complex. And with AstraZeneca, there is certainly moves in terms of diagnostics, in terms of clinical trials. These are important parts of the puzzle. Do you want to talk about that a little bit and what can be done and why it's important?
Yes, thank you, Janice, and thank you, Bloomberg, for giving me this opportunity to talk to all of you. I will try to divide your question into two parts, diagnostics and R&D or clinical trials. And in the diagnostics part, what is important is we all know that if we diagnose individuals much early, then they have a better outcome, they have longer lives, and in certain conditions like cancer, they definitely have longer survival as well. But this is not only pertaining to cancer, it's also pertaining to diabetes, to chronic kidney disease, etc. So what we are doing is in various African countries partnering with societies, with community groups, and trying to identify these individuals much early through education, through awareness, through screening. For example, in breast cancer, through certain laboratory types of screening, let's say in prostate cancer, and we also use artificial intelligence-based solutions in certain conditions like lung cancer. And with all this, what we are doing is we are identifying individuals at an early stage and probably giving them a chance of quote-unquote cure, which we don't commonly see in cancer, but we are seeing with the availability of new medicines. So this is what is happening across the whole of the African continent. You talked about clinical trials, and when we look at clinical trials, we often feel it is phase 2 and phase 3 clinical trials, and these are important programs. But we must understand that the capability and the status of every country in Africa is different. So when it comes to phase 2 and phase 3 clinical trials, we know that countries like South Africa have an historical advantage because they've always been participating in global trials. But we also know that in the recent few years, with better regulations, countries like Egypt have a significant advantage over others because of good health infrastructure, because of large number of patients and healthcare centers. So these are countries where we are doing phase 3 trials, across many indications. There are other countries, where we will then have to start with real-world evidence studies, which are also very important because they talk about treatment patterns and demographics in that population. If somebody asks you, what is the prevalence of lung cancer in Morocco, you will probably go through individual centers. But if there are registries that are created, then it gives you a nationwide picture or a continent-wide picture. And that is what we are encouraging to do. So to answer your question, with every country, there has to be a different approach because all of them are at different stages of evolution. And a solution that works in one country may not necessarily be the solution in the other.
Absolutely. I mean, it's the classic thing that Africa is not a country, it's a continent, and there are a lot of different countries, not just by regulation, but also by burden of disease. Afsane, one of the other important parts of the puzzle is funding. What do you feel are the biggest hindrances that we're seeing at the moment in terms of funding? I mean, healthcare has been mentioned on several panels today, along with education, as one of these really important things to have funding for in terms of ultimately economic growth in a country. But it is a social spend in many ways, and that's sometimes a hard sell. What do you think are the hindrances, and also how can we improve?
Absolutely. So as a large investor in social infrastructure in Africa, largely healthcare and increasingly education, we do see it as a huge opportunity. It is the primary focus of our funds. I think one of the things we've learned from the COVID crisis, and they say you should never waste a crisis, right? And there were a lot of learnings from that. And one of the wonderful learnings was the public-private partnership. I think one of the biggest hindrances for investing in private healthcare on the continent has been, with very few exceptions, who is the payer of goods and services. So, Africa does not have. Africa is a continent with several countries. There are very few countries that have moved towards universal healthcare. I would say a huge congratulations to Morocco. It's been one of the more visionary and progressive countries. And as a result, you've seen a huge amount of investment successfully and profitably into primary and tertiary care in Morocco. I think one of the biggest hindrances is the lack of a government payor system across many economies, but also a dearth of investment, not simply in vaccines or in pharma, but across the whole patient care pathway and the whole healthcare ecosystem, including health insurance, including investments in human capital. As an example, a country like Côte d'Ivoire has 14 oncologists across the whole country, and the likelihood is by next year, 7 of those oncologists will likely be living in Europe, right? So it is very hard for a private investor to rationalize investing often tens of millions into pharma, into tertiary healthcare, without the reliability of knowing there is the human capital to support that ecosystem, but also that there is either a government payor or a sufficient coverage for the population of private healthcare. And I will say that in itself is an incredible opportunity, right? Governments in Africa, particularly post the COVID-19 pandemic, tangibly realize the importance of the health of their population, but also the importance of having health security nationally. And investing in universal healthcare will allow the private sector to invest and create local solutions for these local markets that won't be subject to vaccine nationalism. And ultimately, if you build great hospitals and great research facilities and great primary care centers, you will then also encourage the human capital to want to stay in country and contribute.
Viraj, you've got an interesting project happening in Kenya. I think it went live in April. Would you like to talk us through that a bit?
Yes, so I think the situation in Kenya was that for lung cancer, for a particular genomic markers, and as you know, the diagnosis and treatment of cancer now is based on personalized medicine. That means you have a biomarker, and then if the biomarker is positive, then individuals have access to targeted treatments, and it is proven that targeted treatments are associated with better outcomes and lesser safety issues in those identified populations. And for the testing of EGFR mutations, which is in about 15 to 20% of the population, the samples had to be sent outside the continent, and this was happening. Now, if you need to build the infrastructure in Africa, we need to partner with societies. We need to partner with healthcare institutions and build the infrastructure here, not build the infrastructure somewhere else. So that's what we did. We started collaborating with an healthcare institution in Nairobi. And we said, is there an interest? And they said, yes. Could you help us with technological transfer? Could you help us in updating our own skills and capabilities? And as a result of that, we are very happy to state that effective 1st of June, this center has gone live, which means EGFR testing for non-small cell lung cancer will now happen in Kenya. And we also worked along with the public sector and private sector. Can these benefits then be provided to the wider Kenyan population and not only to the population which is coming to that hospital? And these are innovative models of healthcare that we should look at. So it gives us immense, joy on one hand, but also pride that we have partnered to build something which did not exist on this continent. And there are several other examples across the area where we have done that. For example, last year we did it in Saudi Arabia, where all our genomic markers are actually tested in Saudi Arabia, and we do not export it outside. That's a partnership between a pharmaceutical organization and the healthcare system.
And reduces a lot of time. Lamia, in terms of the barriers to developing full domestic, whether it's vaccine manufacturing or other pharma, what are you seeing as the main barriers?
There are many, and I'm still optimistic.
Good.
But there are many. I think the first one, and perhaps I will open a passionate debate concerning the IP protection. So everyone heard about the dispute concerning the IP for the COVID. And we can talk about this problem for every medication we have. So when we are talking about equity and sustainability, we cannot accept the level of medication we have now, and especially in chronic diseases and in some diseases which are endemic now. So this is really an issue. I'm talking as a Moroccan company, a national company who wants to help Morocco and Africa to go forward. So we cannot develop a product until the patent goes, and it takes 20 years. This 20 years, 50 years ago or 20 years, we didn't see it because we didn't have all information. Now it's mondialization. Everyone knows everything about everything. So it's very difficult to stop this, and I think that we really have, and now it's Bloomberg, so we are with Western countries and African countries. We really need to address this point, because we are seeing in Morocco now it's a very, very big challenge of covering all the population, and it's a big challenge that our king take also after COVID, is to take all the Moroccan into insurance, and I think, and we all think that it is the solution for health for all the countries, but they cannot do it with this kind of level of medication. So we have to find solution, and solutions is first giving the opportunity to manufacture this product as a low price and give the opportunity to do it locally. So this is the second barrier. Unfortunately, there are many Africas. There is not one Africa. And each country, and we don't have the market to develop. When a company develops a product, if you sell it in Morocco, you will perhaps amortize in 30 years. If you develop it in Europe, as its regulation is harmonized, it is opened, you can just amortize. So this is really a point that we have to work together. And we are talking about ZLECAF and all these things. But I think that when you are on the market, it's not the case. So we have to go in each country. Each country has her regulation, its distribution way. And in this case, it's very difficult to think Africa. Unfortunately, there are companies in Africa, and some countries, and we talked about Egypt, we talked about Kenya, we talked about Morocco. We have technologies. So we don't need technologies from outside, but we need to work together to implement it and to be part of this change in Africa.
And governments, potentially taking the knock, so to speak, financially, by creating the demand, having the uptake, even if it's a little bit pricey initially, because of the long-term view on that. Afsane, you touched on the human capital aspect and migration, but one of the things which I've heard a lot of people say who have potentially left their home country is that their granny or other relatives are still there a lot of the time, and healthcare is so fundamental, especially as people are aging. You spoke to me earlier about telehealth and had such an interesting example then. As you mentioned human capital, I was thinking, when people are seeing their relatives being helped for the first time, that would be quite an attraction to stay if they felt they could be part of that. Would you like to talk about that? I think one of the interesting points you made is how we see in many parts of Africa people moving out of the cities as they age.
Absolutely. So one of the investments we've made, one of our first tech investments, is we've made an investment into a business called My Dawa, which in Swahili means My Drugs, which is the largest online pharmacy in East Africa. And a great collaboration we had with the Gates Foundation is they gave us a grant to also build out telemedicine. So one of the huge opportunities in Africa is that it is white space, and you're often not competing with other companies to gain market share, but you're actually in itself trying to create a market. So we were thinking of creative ways in which to get more patients and to get more people to use our online pharmacy service, and we did a trial in rural, sort of semi-urban Nairobi, where we sent a region a text message saying, text this number if you would like to see a doctor. And the dynamic was a lot of older people move out of the cities and are entirely reliant on their families and children to bring them medication on the weekends when they have time, when it's convenient. We had expected we would get 200 to 300 responses. We ended up with 4,500 responses of people who wanted to see a doctor. So we had to stop the campaign because we were inundated. But what we had realized was we did eventually facilitate virtual consultations with these 4,500 people. And it was great. It was a great commercial opportunity, but also a somewhat tragic realization of the market that almost all of these 4,000, some elderly people were misdiagnosed, latently diagnosed, undiagnosed for chronic diseases like hypertension, diabetes, other forms of heart disease. The economic opportunity for us is we were able to send some 4,000 something online prescriptions and ended up with this incredible new patient pool. But I think it also underpins the narrative that people often think of Africa as very poor or not having access to technology or not a consuming population. But yet even semi-urban rural populations who are elderly have the desire, the need, and the ability to purchase medical products online. And it's an incredible example of how the continent is able to leapfrog. And oftentimes there are no large incumbent multinationals to disrupt. So actually taking market share and growing your business in a relatively uncompetitive environment is often easier than in more developed markets that people perceive as very stable. And I will say, in terms of social impact and in terms of social return, that business, I'm happy to say, grew nearly 300% last year, and is making an incredible social impact in terms of reaching people who wouldn't otherwise have access to healthcare. So I think there are other ways in which people can contextualize, both private and public investors, the need for investing in social infrastructure in Africa.
We are getting near the end of our time, but one of the things you've just said, which I think can be so relevant for healthcare, is AI. I'll just throw it open if anyone wants to jump in. How they see that potentially helping or not particularly.
I will start the discussion. Artificial intelligence is here to stay. We must understand what is the role of artificial intelligence and what are the limitations of artificial intelligence. It is not a panacea that it would solve all problems. One area where we have incorporated is again through a partnership. Through an organization called as Cure AI, which originates from India, is on how do you screen and diagnose patients of lung cancer on an X-ray using artificial intelligence-based technology. So you have an X-ray, and incidentally, the nodule is missed. The patient keeps on coming after a couple of years, a couple of months, the disease has progressed. But with this, we identify that this individual could be at a higher risk, could be lung cancer. So you look at this patient more closely. You do a pathological diagnosis, and then you confirm whether it is lung cancer or not. So definitely there are areas where artificial, and this is happening in Africa. This is happening in Egypt. This will happen in Morocco very soon, and also Algeria. So this is not science fiction, but this is things that we are doing. And there could be many other areas where you could use artificial intelligence as well.
I would say another big opportunity for artificial intelligence is to bridge the limited human capital, right? So I think the African Development Bank had said that Africa would need 200 years at the current population to grow enough doctors, and that's if the population didn't grow at all. I think one of the things that AI can do very effectively in primary care is symptom triage. So it's not going to replace doctors or nurses, but particularly through digital health, there are lots of very creative and very effective AI tools where you can enter your symptoms, you can upload pictures, it will tell you it is likely it is one of these three things. It'll give you a tiering of how urgent it is. And then that information can then be given to a medical professional, whether it's a doctor, whether it's a nurse, whether it's a technician. So what I think it allows the continent to do, and many frontier markets and developed markets to do, is to stretch the limited human capital available. I think it's definitely not without its risks, and it is not the equivalent of a medical degree, but I think it will allow health equity on the continent, and it will allow people at least some access to healthcare who otherwise, have very little.
Yeah.
IA perhaps it's not the solution, but it's clearly help. And I can add another topic is the data. And unfortunately, in Africa, we have a lack of data, and this data is very important, and especially in health. You told that each country has her diseases, and in Africa, we cannot follow all the diseases. We have no information about epidemiology of the disease, and I think that unfortunately, it's the first level of IA, but we don't have it in Africa. So I think that. And things could be very easy. And I'm sure that with all what is installed now in terms of clinics and private and new hospitals, it could be easier to address. Yeah.
Well, thank you very much. We are out of time. I trust that you've all had a productive day. And thank you to my panelists.
Thank you.